Dental Nachos crew, it's Paul, Dr. Nacho, with a special segment, Spicy Toppings with Dr. Nacho. What can we bring to you value-wise, discuss some of the challenges that are going on in our industry, a real JBR, just be real type of thing. So I'm really excited to have Dr. Whitney here. She's an orthodontist. She's going to share what she does in this dental world. But before she shares that, Whitney, you know, we're all dentists. This has been a challenging time during this coronavirus crisis. We're dealing with extra stress. If people only watch us for 60 seconds, what is one thing that you would recommend we do more of to decrease stress during this time for ourselves?
Sure. Thanks for having me.
Sure.
So as all of us know, wearing all this PPE, I double mask, I wear face shield and the gowns, it's really physically and mentally demanding. So I really recommend stepping back even in the middle of the day, taking a mental and literal breather. So whether it's going out for fresh air or doing like a 5-minute meditation, really just stepping back and building that into our schedules so that we're not just going. Because I really do think wearing the double masks is causing an adrenergic or sympathetic nervous system spike.
I'm totally with you. I see that. I was at my office yesterday. It's like drinking more water is important too. And you know, we watched this movie in my house like 9,700 times. It's called Frozen 2. I'm not sure if everyone's aware of it, but it stars Anna and Elsa. I don't know if you've heard of them. They're not very popular characters or anything. But one of the songs, when I teach residents, I always say, when you get out there in private practice or GPR, it's going to be way different, right? There's going to be all these things happening. Crown's not going to fit. Someone's going to be upset. Your contact's not going to be right. And you're going to have some sort of stress point or intensity point. And what I want you to think is, just do the next thing right. Just do the next thing right. And sometimes you got to walk away. So tell the patient, take a mouth break and walk away. And I think we can do that here. In that movie, there's a song, Do the Next Right Thing, which we listen to a lot of times from Anna. She sings it. And it's a good dental thing. And sometimes I believe, you know, what you're saying is so true. Just do the next thing right and give yourself a break. You can't be a good dentist if you're overheated, you have these problems. But in the flow of a day, sometimes it's difficult to do that. So I really think that's awesome value. You had to take that water break, meditation break, even, you know, walk outside. I do that at my own office sometimes. I do it to hide from people, but that's okay. Maybe they'll find me out in the street. So tell us, Dr. Now, I really like sharing stories. I always say story is the star. So tell us a little about your story from dental school, residency, and what you're doing now.
Sure. So I've been a tooth obsessor since I was like 5 years old, like literally, like I remember watching little kids lose their teeth and I was like, oh my gosh, what's that? I have a letter in my office that I wrote when I was 12 and it's like, I want to be an orthodontist when I grow up. So yeah, I've been like from early on obsessed with teeth and orthodontics. I did pursue other options to be curious and make sure dentistry is really the right route for me. And yeah, I did my dental school up at Harvard. I graduated in 2012, and then I did my orthodontic residency in Chicago and graduated about 5 years ago, which seems like forever. But yeah, and then I moved to Manhattan and have been here since and started my own private practice in 2017. So starting from scratch definitely is a nice challenge. I think it's really rewarding and you get to practice exactly how you want to and have pride in your work and not be dictated by another dentist. Because in orthodontics, it's whether you're working at an associate's office or even a general dentist would try to dictate how I was practicing in my own specialty. So that would be a little.
Now you have control. That's right. And you know, these are the things like the business aspect people don't always tell you about in dental school. But I don't always tell you. I mean, they never tell you. And one of my mottos is ABC, always be connecting. So I have a close friend in Manhattan who's an amazing dentist, and he is now looking for a general dental associate to work 2 days a week. Whoever works with him will be amazingly lucky. He's an amazing dentist, even a better person. So if anyone's watching and interested in a 2-day-week position in Manhattan, working with a high-level restorative dentist, just reach out to us at jobconnect@dentalnachos.com. Or I'll show my little board here. It's very high tech. No one be too impressed. If you text Nachos to 215-543-6454, you'll get a free CE prize, but you also can ask about that job. So Dr. Whitney, I really appreciate you talking with us. I asked for, you know, for spicy toppings. Spicy doesn't mean bad. People love spicy food. So, you know, spicy is a little bit out of the ordinary. What could we add to our nacho plate of dentistry? So tell us what you're doing with this, bridging the gap between medicine and dentistry, and what we could do more about with awareness to be better professionals, be better people. I'd like to hear about that.
Yeah, sure. So a little story. In New York, we were shut down for quite a long time as we were at one point the epicenter of this virus. And I was involved with some dental groups, and I really felt like dentistry wasn't being advocated. There wasn't awareness of the needs, like the public needs of dentistry, whether it's
Yeah.
the dentist side or patient side, or even the relationship between physicians and dentists. And I started an Instagram page called Beyond This Mask so that we
Awesome.
can educate other dentists, the public, physicians, try to, create a bridge between everyone and highlight our experience as dentists, offer educational pearls about dentistry, and just, be really vulnerable, raw, and
Love
real
that.
with our life experience. So yeah, it's been really a cool project. I've gotten dental students, dentists of different ages, different countries. It's been international, which is
That's
really
awesome.
cool.
So how can people learn more about that? They can follow on Instagram Beyond the Mask, is it?
Yeah, Beyond This Mask.
Beyond
And
this
yeah,
mask?
feel free to direct message there. I'd love to get as many posts and perspectives as possible and keep sharing, sharing our journeys. That's kind of the point. I want to show that, we're not like behind the mask, there's really a person, like, because right now we're going to lose our identity. We're all covered
Right.
up. So, really sharing our experience and journey, our values, even passions outside of dentistry, really that we're multifaceted people.
Dentists are people too. Dental Nachos is about bringing your people first, people part first, your dentist self second. And you see this, in a real spicy topping, when someone has an identity, it could be a mom, a dad, a brother, a sister, a dentist, a PTA leader. And for any reason, if that identity shifts, we had someone come to our new dentist boost camp. We're doing our next dentist boost camp in January. You can text boost to 215-543-6454. But we had an amazing specialist share. She became permanently disabled for her profession of endo with a hand injury. So she had lost her identity. How did she rebuild that again? And I think, one of the main points is remembering you're a person throughout this entire time. Remembering you're a person 2 years out of school, 20 years out. I really compliment you for doing that. I think that's awesome. So people can follow Beyond This Mask at Instagram. And you also do some other leadership things. Tell us about that. You do some things is it with AO or with NYU? Tell us a little bit about that.
Yeah, so I like to keep busy. So I well, right now NYU's in like an in-between space, but I teach part-time at NYU in the orthodontic clinic. So it's a really nice way to stay engaged with the present and the future and pay it forward. And I also am involved with an international dental society called Alpha Omega, which
Awesome.
actually is the second most involved philanthropy, I can't speak,
That's
behind the
okay.
ADA. And yeah, we're very involved with international outreach and dental services, as well as continuing education. And there's local chapters, so there's the New York chapters and
I've
international.
been involved with that too. There's an amazing guy, Dr. Mark Rothman, who's my friend. You can tag
Oh,
him in
you
here.
know him?
Oh yeah, yeah, Mark. So you can
Awesome.
tag Mark in here. So, and this
Awesome.
all fits with my always be connecting and always be part of a community because dentists lose their community. I work with 6 other dentists, but sometimes only 2 or 3 at a day. Most dentists are working by themselves in caves, so can
Yeah,
connect with
it's
their
lonely.
community. Before we finish up, I want to ask you to help our Nacho community. So what we're doing this on August 9th on Sunday is I'm creating an associate survival kit and job fair. I'm creating a virtual way for practice owners, associates, dental students to all learn about how to find a job, how to meet people, how to do these things. Now you leapfrog some of this because you went to become an orthodontist, but I'm sure you have friends and you're close enough to school. So new moms, as your child grows, you forget the new mom feeling, right? So we have a 6-year-old and a 2-year-old. When they're 16 and 12, my awesome wife is not going to really be able to relate to a new mom anymore. So share with us from your friends' stories or people you've heard, what in finding a job in general dentistry or anywhere, do you have any recommendations or have you heard some challenging stories of stuff to avoid?
Yeah, I mean, I did my dental school and residency in 2 different states, and I moved to New York literally starting from scratch. I just literally dove in, got really involved with the local dental societies like New York County Dental Society and also Alpha Omega, the New York chapter. And I actually, in the first, I mean, it's probably hard in times like today. In the first month before I got my license, I literally knocked on every door.
Yeah.
I went
When
on
knocking on doors
Google
has become
Maps.
illegal. So what I want, and Dr. Mark Rothman is a perfect example. I'm encouraging D1s to watch in on this all the way up to 40 years out of school. It's a free watch and pass. My team can share that. But the reason is, if you're a D1 or D2, you know how to talk to people, you can connect with people, and building your network, meeting a Dr. Mark Rothman, a Paul Goodman, even someone like you have referrals who are general dentists. Connect with people early, meet them as people, so you have these resources, because what happens is desperation sets in, and whenever we're desperate for anything, we don't make good decisions. So I'm trying to get this story back that we all should be talking about jobs for dentists, because it solves problems. A practice owner needs an associate to work with them. You may need an associate in orthodontic practice, but it's all about knowing people. And I think, I compliment you for knocking on doors, but right now we're not even, I encourage it.
Yeah,
You don't have to do that.
that's not going to be applicable today, but yeah, it was scary. The first door, I remember my heart racing, like, oh my gosh, what do I even say?
Well, that's because dentists are good with, this is my line, dentists are good with patients, not people. We're good with patients, not people. Each other, no idea what to say. Patients, gentle jokes. So we need to really exercise that muscle for so many reasons. And this isn't just about finding an associate position, selling a practice, bringing in a partner. People go on maternity leaves, right? They go on maternity leaves. How do you find someone to help? You might not, so knowing people who know people is the key to success in life, especially for dentistry. So I really appreciate that. If you guys want to join that, just text connect to 215-543-6454. Before we wrap up, Dr. Whitney, this has been awesome. Is there any parting words you have for the Nacho verse? You could say, go out and do this, share something about you. We'll give the final words to you.
Yeah, I mean, I also would say in terms of the job hunt, like, never settle. Like, I think it's so easy to find some non-ideal job, whether it's hours or the work ethic. Like, I waited it out, and that it wasn't fun, like the first few months and starting from scratch in a new city. But I think, stay with your values, because that's
so critical. And I feel for the dentist graduating with debt, and we talk about this, but I often say it's better to have no job than a bad job, because when you have no job, you're open to getting a better job. And it's hard, because I say finding a job is a lot like dating, but you can't date a job, right? You can't date 4 different jobs and say, oh, do you want to go out for calamari? You want this? And it's hard. That's why the more you prepare yourself early, and it's all about communication and knowing people, and having good advisors too, like a dental focused attorney. So I really appreciate that. We're going to jump off Facebook Live. Dental Nacho crew watching. Remember, you can text Nachos to 215-543-6454. Get a free CE prize. Dr. Whitney, I appreciate your time again. What's that Instagram we can all go and follow and add to our account now?
Sure. It's Beyond This Mask. And my personal is Dr. Whitney Ortho, if you have personal questions, not related to the mask.
About Invisalign, message about Invisalign, aligners, ortho, or just, being in dentistry. Well, the more we share, the better world we'll build. And thanks so much, Dr. Whitney. Have a great rest of the day.
Thank you. You as well. Thank you for having me.